Hello everyone, thanks for coming out here today. We really do appreciate you guys. Thanks for your continuous support and thanks for always staying tuned to our channel. Remember, we are here to keep you updated with all of the latest and most reliable happenings in our country. Yes, the news we've got before our decks is coming from SERAP, Socio-Economic Rights and Accountability Project. They have some issues with the Ministry of Health and NCDC over failure to provide full account for the COVID-19 monies. And we'll get more details into what is going on in a moment, guys. But before we do, please, if you haven't yet subscribed to our channel, click on the subscribe button down below and don't forget to give us a thumbs up, hit on the like button. It really does mean a lot to us. Right, let's get straight into the news. SERAP sues Health Ministry, NCDC, over failure to account for COVID-19 money. Socio-Economic Rights and Accountability Project, SERAP, has filed a lawsuit against Dr. Osagie Ehanire, Minister of Health, and Dr. ťrøūþłě, Director General, Nigerian Center for Disease Control, NCDC, over their failure to account for the public funds and other resources so far spent and used to combat the spread of COVID-19 in Nigeria. In the suit number FHC/ABJ/CS/C16/2020 filed last week at the Federal High Court, Abuja, SERAP is seeking an order for leave to apply for judicial review and an order of mandamus to direct and compel the Minister of Health and the NCDC to publish details of the funds and resources from the federal and state governments and the private sectors, as well as details of how the funds and resources have so far been spent and used to combat COVID-19. SERAP is also seeking an order of mandamus to direct and compel the federal government to disclose information on the exact number of tests that have been carried out for high-ranking public officials and politicians, the numbers of any such high-ranking public officials and politicians now in self-isolation or quarantine, as well as the exact number of tests that have been carried out for the country's poorest and most vulnerable people. SERAP is urging that transparency in the use of COVID-19 money would help to reduce the risks of corruption or opportunism, build trust, and engage Nigerians in the fight against coronavirus, as well as save lives. Transparency and accountability are important to implementing an effective response to COVID-19 and slowing the spread of the virus in the country. According to SERAP, Nigerians have the right to know the details of spending of COVID-19 money, as this is essential to the fight against corruption and will foster the development of democratic institutions and the rule of law in Nigeria. The suit followed SERAP's Freedom of Information (FOL) request dated 27 March 2020 to the Minister of Health and the NCDC, expressing concern that lack of transparency in the use of the funds and resources to combat COVID-19 would lead to the diversion or mismanagement of funds and resources, unnecessary cost lives, and result in serious damage to public health in the country. According to SERAP, millions of Nigerians continue to lack access to an improved water source and to proper sanitation, thereby making them vulnerable to COVID-19 and other illnesses. Yet the Ministry of Health and NCDC have failed or refuse to disclose whether there is any collaborative work with the Ministry of Water Resources to provide vulnerable Nigerians with safe water, sanitation, and hygienic conditions. The suit filed on behalf of SERAP by its lawyers, Kolawole Oluwadare, Atiku Adejeyigbe, and Opeyemi Awolabi, read in part: the information SERAP is seeking to access is permitted under the Freedom of Act 2011 and African Charter on Human and People's Rights, to which Nigeria is a state party. The federal government has a legal duty to ensure that information on the spending of COVID-19 money and resources is released to SERAP and widely published. It is not too much to ask for details of measures to protect health workers and procedures put in place to ensure that COVID-19 money is not diverted, mismanaged, or stolen. The federal government has no legal justifiable reasons for refusing to provide SERAP with information requested, and therefore this court ought to grant SERAP the order directing and compelling the federal government to publish details of spending of COVID-19 money. There are reports of lack of transparency in the use of the funds and resources being mobilized to combat coronavirus, and the authorities are prioritizing home testing of politicians, with some reportedly taking multiple tests. Politicians engaging in multiple tests for coronavirus have in turn slowed the number of tests for the country's poorest and most vulnerable people. The suit is in the public interest as it borders on issues of national interest, public welfare and interest, social justice, good governance, transparency and accountability. Obedience to the rule of law, particularly by those who publicly took oath of office to protect and preserve the Constitution, is a desideratum to good governance and respect for the rule of law. Nigerians are entitled to know how the Commonwealth is being utilized, managed, and administered in the domestic setting, as this positively influences the feeling of belonging in the society. The right to know will no doubt help in promoting a transparent democracy, good governance, and public accountability. An order granting leave to the applicant to apply for judicial review and seek another of mandamus, directing and compelling the respondent to provide and disclose the following information to the applicant: detail of exact funds and other resources allocated by the Nigeria authorities and private sector donation to the respondent to improve Nigerians' health facilities to combat the spread of COVID-19 in Nigeria. Details of spending and planned spending of any such funds, other resources, and donations to combat the spread of COVID-19 in Nigeria. Also, details of efforts made by the second respondent to make NCDC's website functional and accessible to publish weekly spending on initiatives by the NCDC, including on NCDC's website. Also, details of processes and procedures put in place to ensure that the funds, other resources, and donations allocated to combat COVID-19 are not diverted, mismanaged, or stolen. Details of measures to protect health workers and to encourage the country's poorest and most vulnerable people to come forward for testing and to escalate testing for this group. The exact number of tests that have been carried out for high-ranking public officials and politicians, the number of any of such high-ranking public officials and politicians now in self-isolation or quarantine, as well as the exact number of tests they have been carried out for the country's poorest and most vulnerable people. And for such orders, this honorable court may deem fit to make in the circumstance. No date has been fixed for the hearing of the suits. So, my people, this is what SERAP is asking for, and as we can see, is definitely in the interest of Nigerians. With the Minister of Health and also the Director General of NCDC, they really have questions to answer. It's not too much to ask for them to provide detail of the spending. We know when this COVID-19 started in Nigeria, a lot of well-to-do Nigerians made a lot of donations, and as we can see here, it's been alleged that it's just some politicians, they have access to run number of tests. They run the tests a number of times, as a result depriving the common Nigeria the access of also having that opportunity to run tests as well. So they are filing this suit against them to present an account detailed account of all they've been doing with the money. Guys, leave your take, leave your comment down below in the comment section. We want to say thank you once again to all of our subscribers. Please, if you haven't yet subscribed, click on the subscribe button down below. And don't forget to give us a thumbs up, hit on the like button. It really does mean a lot to us. Till I come your way again, it's bye for now and God bless.